Okay, I'm going to demonstrate the use of some self-use therapeutic tools that I give to patients for home use. And the first of which is called the Theracane. I like to get my patients involved in the therapy. And I'm a myofascial acupuncturist. I actually focus on trigger points. And what we're trying to do with these tools is actually to find those trigger points as well. So they can use these tools in between treatment intervals. And so it'll help speed up the healing process and actually get them involved in the therapy as well, which I think is always a good idea. So for upper body pain, upper trapezius pain, levator scapula pain, supraspinatus pain, even rhomboid pain, the Theracane tends to be a little bit better. And the way we use this is we place this in the position that we want, over the shoulder, and we're kind of in a slump position a little bit. And then I take my hand on the opposite side and apply pressure downward, and then I sit up straight. And so I want to try to keep this area that I'm applying pressure to as relaxed as possible, and yet apply pressure downward, like so. And the key with this is to actually apply pressure for about 30 seconds. So muscles tend to gather into focal muscle spasms, right? They're called trigger points. And most massage techniques in this country are actually more gliding techniques. They kind of glide over the muscle. But you can never totally break up a trigger point just by gliding over the muscle. So the Japanese developed a technique called Shiatsu Massage, which is a compression massage, which is, instead of gliding, they're actually applying sustained pressure to the muscle, specifically on the knotted muscle. And that compression forces that spasm to start to relax. So it's probably the best technique for treating pain, much better than actually gliding over the muscle. We actually want to find the trigger point, locate it, and apply steady pressure on the muscle. So again, this technique for upper back pain is probably the best technique to do it. And one thing I like to do sometimes is even just rest the arm over this little knob here, so it relaxes the muscle. Hold down with the opposite hand, sit upright, and let the pressure apply for about 30 seconds, like so. Same thing on the opposite side. We want to slump a little bit, put it in position, use the opposite hand, apply pressure downward, and sit up straight, like so. Or you can rest that hand over the tool, like so. Again, sustained pressure is the key. You want to hold the pressure on the muscle, give the muscle a chance to relax. This is something that they can do daily, daily treatment. They can even be sitting at their office space in a chair and do this at work. Because this tends to happen, especially when people sit in front of computers, their muscles tend to subconsciously tense, especially the levator scapula muscle, which is the muscle that allows you to elevate your shoulders. So that's the muscle we usually try to target. And if they apply the pressure to different spots, they'll find a spot that is specifically tight and tender on palpation. So we want to try and get, again, pressure on that particular point. Okay? So again, this tool is best for upper body tension, trapezius area tension, rhomboids, supraspinatus muscle. This is the tool of choice. Now for low back pain, I actually use a tool called a knobble, which looks like this, a silly looking tool. And most people use it incorrectly. They actually use it with the point upward, because we're actually going to lay on the floor when we use this tool. And we're going to actually use the edge of the tool to apply pressure. And the muscles we're targeting are the lumbar paraspinal muscles, the erector spinae they're called, and the quadratus lumborum. And low back pain tends to accumulate in one of those two muscle groups. So by laying down, the reason I like this tool a little bit better, especially for low back pain, is that you can actually lay on the floor. And when you're laying on the floor, the muscle is totally relaxed. Ideally, you want to apply pressure to a muscle that's in a relaxed state. You'll get much deeper into the muscle. So I'm going to get down on the floor. I'm going to show you how to use this tool for low back pain. Okay, so this is the knobble. And again, I want to place it on its side like so. And I want this point to be facing towards the spine. So I'm going to lay like so, and I'm going to actually, and you want to keep your knees up and your head down. And I'm going to just roll my knees away just to create some space to place this along those paraspinal muscles, so it's the inner shoe line. And then I'm going to roll my knees into the area. And the more you roll into it, the more pressure you're going to feel on those muscles. And I'm trying to find, again, the spots that are hypersensitive, that are more tender than others. That's where the muscle's tight. That's a diagnostic information that you want. You're trying to find the points that are sensitive, that are tender to the touch, and then get this as close to that area as you can, and then roll into it. And then I want to let that sit for up to 30 seconds. Just let it lay on it like so. I'm not trying to roll, I'm just trying to let it sit there on sustained pressure. Then I'm going to roll away. I'm going to move it up or down along that inner shoe line, and then roll back in again. And you want it to feel like a good pain, not too much pressure. Some people complain it's too much pressure for them. So I tell those people, don't roll as far into it. Just roll what you can do and what's comfortable with it, because you don't want to apply too much pressure. Some people I have to actually tell them to put a little towel on it so it's not quite so, because it is a firm surface. Usually people will start with even tennis balls. Some people are really hypersensitive and they can't handle pressure at all. So I'll have them start with tennis balls and then work up to this. But tennis balls aren't really firm enough to really break up a muscle spasm. You need a little bit more pressure, and this is a perfect tool for that. Okay, so you, again, roll away, knees up, roll away, lean back into it, find the spots that are tender, let it sit there. Now to do the other side, all I do is I flip it around. The point's always facing inward towards the spine, and I'm using this edge to hit that bladder line along the erector spinae muscles, and do the same thing. Now you can actually use this too. Actually, I like to use it in gallbladder 30 area also, especially for people with low back pain. A lot of people have referral pain down the hips as well. And you can just kind of let this leg kind of fall to the side and place it around the gallbladder 30 area and just kind of roll their body weight into it. And you will definitely feel that pressure on that point too. Or you can just move it around a little bit. Some people feel more pain around gallbladder 29, around that area also. So you can just place it in that area also. So you're trying to search out the points that are tender, where the muscle is tight, where the trigger points are, and you're trying to get sustained pressure on those spots. This is a great tool to do so. If you like this video, please subscribe and feel free to comment and share ideas about acupuncture techniques below. These tutorials are in correspondence with my book, which is linked here. Thank you for watching.